We want to welcome you all into Coronavirus Inside the Arizona Numbers. We're just coming on the air, and there's a bit of breaking news that has just come in, and that is that the U.S. expert panel has endorsed the Johnson & Johnson single-dose vaccine. So we knew that it was expected to come down on this Friday afternoon. We were just waiting these last few minutes, and it has come in. So let's talk about that timeline here, Garrett, and we'll get to some of these numbers. If it's based on the other approvals that we've seen go through, which also conveniently happened on a Friday. That gives us a pretty good idea. Shipments started on a Monday. They arrived in our state by Tuesday. They were in the arms of Arizonans by Thursday and Friday. So they're saying that could be along the very same timeline here in the state of Arizona. So once again, Johnson & Johnson approved as expected by the Food and Drug Administration. So this is the third coronavirus vaccine that's been available, but it is the first one to offer just one dose. So that could be a real game changer, and the first to be stored at easier to transport, if you will, temperatures, Garrett.
Now, my understanding, and I haven't been following entirely closely here, but the last I heard about the Johnson & Johnson vaccine was that there wasn't a whole lot of supply initially.
Yes.
Okay.
And the big concern is when that supply is then shipped out on Monday, how soon can the second supply come? That second and third supply were of the biggest concern, because everything's all ready to go for this approval, knowing that this could happen on Friday, but then how soon can you make up those doses behind it? So that will remain to be seen. Those will be allocated out throughout the state as well, just like we've seen through Pfizer and Moderna. So
for our purposes, for data purposes, what's going to be interesting is how they handle a single shot vaccine in the dashboard. So we're all expecting, and we've all been looking at this data for a long time, and it's always been 1+ dose. So, but there's always a category for fully vaccinated. So my expectation, of course, is that since this is a 1-dose vaccine, it would just be rolled into this. It would be included in the 1+ dose and also the fully vaccinated. So
yeah,
that's obviously the intuitive part. But again, I don't know how the structure behind their dashboard is and if it's built to do that. So
and how they're going to handle that. Yeah,
exactly.
Okay, so we'll try to get information for everybody who follows us on here before that happens next Friday, or see how they're going to handle that. Why don't we start there on the dashboard today, Garrett, with the vaccinations?
Sure,
I have some of the percentages. I have some of the percentages around the U.S. too while you're pulling that up. So across the United States, we have 14.2% of those with that initial dose, that initial vaccination. Compare that to the complete set here in the U.S. of 6.8%. So once again, 14.2 and 6.8, and we can see on the screen there where you're reading that for the state of Arizona and how we compare locally to that national number.
Now you see right now we do have we're at 1.66 million administered, 1.610 ordered. So we actually have an over reporting of about 3%, 103% doses utilized right now is what the dashboard says. My understanding. So just to let you know, I've been told that there was an error with some of the data down in Queen Creek, and this could have something to do with that. I'm not really sure why it's saying 103 right now, but I do know that there was some data in the Maricopa data set that was a little incorrect. So they could have pulled those back, and they're going to, just because there was some issues, they're going to put it back on. And that's why we have a doses utilized of 103%. I just don't know yet. I'm just letting you know that also did happen. 16.2% of people have been vaccinated, and just under 500,000 are fully vaccinated. So, and tomorrow we will pass that 500,000 threshold
mark. Yeah. Okay. So that 500,000 equaling out to about 6.9%, almost 7% if we don't hit that today. That's better in both categories than what we're seeing nationally.
Yeah. Oh, yeah. Definitely. I don't have that up right now, but that seems very high for even where we were. So let me go to that. And again, this is usually a day later, the vaccine page. But it looks like we're crawling up there again. We've been in the top 10 before, but sometimes reports are taken kind of differently. They're taken at different times. So it looks like we're not in the top 10 again. They have us right here at 16.4%. And what is that? If you just count states and not the territories, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12th. And the second the second largest jurisdiction of the jurisdictions, the states that have over 7 million population, my apologies, we are number 2, just behind Massachusetts.
Yeah. So as we look down that list, it's got that pull down bar. If anybody wants to check this out, this is from the WashingtonPost.com.
Yes.
But you can prioritize the list based on a full dose, that both doses of the vaccine, or just the first dose, and be able to look at those categories. Alaska's maintained their spot on the top of this list for a while.
For quite some
They've
time, absolutely.
Yeah, they've done a great job getting the vaccine out there, especially against all the odds with weather and everything else that they're dealing with. Okay, so when we see these numbers, I'm getting a lot of questions too, Garrett, on how we compare around the world to our vaccination rates. Some encouraging news. We've kind of talked about Israel, and they have half their population vaccinated already. Comparing that to other countries around the world, I know the New York Times had a really good list of how country versus country compares and how their rollout is working and what's not working in all of this. And that's kind of where I've been directing people who have questions about how the U.S. falls in there. We're still in one of those top categories to get this vaccine out.
Hold it up for everybody. Again, this is from the New York Times. This is they're tracking the coronavirus vaccinations around the world. As we know, just to caveat anything that is in different countries, especially, data is not standardized in reporting across the world. So obviously, just take some of this, take it with a little bit of a grain of salt, because we just, there's some times we just don't really know what the number is. But here we are. We are in one of the top states here, 20.6 per 100 people, 68 million doses administered, as you said.
So, I mean, we're not doing too bad overall.
No, not at all. I mean, we are fifth in the world. And you just looking at this, it does look like, you know what? I didn't do the per 100 for vaccinated percent. So Navajo Nation, for example, just going with that, and just to talk about things that are doing very well, Navajo Nation is actually up here with Israel and with the Seychelles on their number of people vaccinated on reservation. So we have areas in our in the country that are up there in this top of the world list. But yeah, as the United States is doing quite well. Especially for such a large population, obviously.
Yeah, exactly. 330 million people trying to get this all taken care of. Okay, we want to go back to where we always start. We have more time to talk vaccinations for you a little bit later, and we can break it down by county if you're interested in that too, because there's a push to get more doses to Mojave County, and we have some news on that. We can get back to that in a bit. But Garrett, where we usually start our discussion, and some numbers worth celebrating there today as well, because the number of cases is dropping pretty fast.
Yes, today was the first day in 9 days that we broke the 1,500 barrier. We had sort of been hovering around this 7-day new case average of 1,500, and it would go up by a couple, down by a couple, but really we stayed within the 1,500 to 1,600 range. Today was the first day that we broke that range. Today we're at 1,487. You can see 1,621 cases added today, 83 new deaths added to the report. That average is now at 68, so it's below 70 for the first time as well. And we actually have a ramping up of testing. Our testing is now at 11,510 today. That brings our testing average to over 10,000 for the last 2 days, and it hadn't been over 10,000 since February 15th. So you can see we're definitely showing a ramping of tests right now. And our positivity rate has actually gone down a little bit today. It's been climbing very slowly, but today it's gone down again. So hopefully that trend continues on a downward, just downward compared to where it had been going, because it had been going up.
Yeah, overall.
Yes.
I know yesterday we weren't on with everybody, but it was a pretty hopeful day as well, because the number of new cases just for that day alone went under 1,000, and you say we haven't seen that since November 30th. So
yeah,
that's a pretty substantial win in all of this, of course, because when we look at case numbers, people might say, oh, a case, whatever, but 7% of cases end up hospitalized, as we've seen in Maricopa County. And as those numbers hold true throughout the life of the pandemic, that means those people would then be headed to our hospitals. Our hospital numbers are also trending down, But as expected, those don't fall as fast as the case numbers that we have seen through all of
In
this.
fact, we are just now starting to see a slowdown in the number of the hospitalization decline. So it had been declining quite rapidly. And I said, we saw about 8 days ago, our case number decline sort of stopped. We shed about 85% of our cases from the peak. And then we really started, the decline is now much slower than it was. And we're just getting to the point where we might start seeing that in the hospitalizations on the inpatient. You can see we've had a very clear, concise line down. And now you can start to see the emergence of a curve right here that is going basically saying, now that your cases have slowed, your hospitalizations will begin to slow as well on its way down. Where are we today? We're at 1354. We were at 1385 yesterday. The ventilator is going down with the ICU. This is encouraging because we still have a quite high ICU number. That ICU number we have, today is actually our ICU number. People on ventilators in the ICU is at 54% today. That's actually a little lower than it has been, but it had been quite high at around 58 to 60%. And that's a very sad number because the number of the higher, of course, the ratio of ventilators to ICU, that means that those people that are in there are in very, very bad shape. And so we want to see that number go down for future. Our ICU beds are not falling in fact, they rose a tiny bit today, but that just might be a reporting blip. It was at 415 yesterday and 419 today. But as of right now, it still doesn't show just one day of reporting going down, going up doesn't really mean that it's changing. So we're going to wait a couple days. I'll watch it over the weekend, but I presume that the ICU numbers will continue to fall at the same rate as at least the hospitalizations. Discharges are down. Emergency room department numbers are down as well. And intubations are up today. So that's something to think about. That there's still serious cases out there. When that number goes up, that's a serious case of COVID-19 that they're dealing with.
I'm curious for the people who are in the comments, like, I'm not getting the vaccine. I'm not going to be a sheep is what I'm seeing in there. How do you propose that we get out of a pandemic? I'm super curious, open to hearing what your plan would be to get us back to work and back to school and back to life if that wasn't the route to go. Super curious on that. In the meantime, Garrett, as we're looking, and then the other thing is everyone who announces that they're not getting it. I appreciate the engagement, but you do you, whatever. Okay, so Garrett, when we look at these numbers and we're seeing these numbers come in, we also passed a milestone number in Maricopa County. We did, in fact, lose 9,000 people, passing that 9,000 mark just yesterday. I know we took a moment as we passed 15,000 throughout the state of Arizona and 9,000 now here in Maricopa County just as of yesterday. And we remember that every single life lost is someone that was loved and cherished. And we have shared a lot of their stories, and their families have been gracious enough to shine a light on how spectacular their life was. And we take a moment to remember them. In the meantime, though, as we see those numbers, 83 were reported in today. And I know you and I took a closer look back. When a death is reported in, it's then plotted onto a curve that helps us better understand the exact date. So just because a death would be investigated for a while is no matter. It is still marked on the chart as of the day that we lost them. And we see those two distinct peaks. Boy, I never thought we'd pass such a sad and high marker in July, and then we see that reflected there in January. So what day ended up the highest for that?
Let me pull off Maricopa here and just go to the so the date. Okay, so the date is the top date of death has remained January 18th. It will likely remain January 18th in perpetuity at this point, and that number of deaths is 169 died on that one day. And
wow.
Unfortunately, what we know enough about COVID-19 to know that the number, the time of disease contraction to the time of death for most people is anywhere from 18 to 27 days. That is the range of when people die. For the most part, it's 18 to 27 days.
And so that's how sad, because that tracks back to Christmas.
It tracks back to Christmas and New Year's. Yeah, those two times. Yes.
That's heartbreaking because a decision over the holidays ended up then being their last Christmas to celebrate. So
It's very, I mean, it's sad,
yeah,
but there is, that's what the numbers have shown us. And people will say,
yeah.
oh, you're fake news, you're lying. But I mean, if you look at all of these, you can quite literally, for any state, anywhere in the world, really, you can see that 7 days for hospitalizations and 18 to 27 days for deaths. This is a pretty standard number for COVID-19 at this point.
Yeah.
It's different in group deaths. So I don't have an epi curve for the age groups. And the reason I don't is because the AZDHS would not, of course, give an epi curve for something like this for 27 deaths, because you can easily track that back, and that would be a privacy issue. So they're not going to give us an epi curve by
the specific dates. So what we can see, though, is how it's broken down, and anybody can reference this at any time on the AZDHS's site. It really shows how dangerous this is and was for people over the age of 65, and why this category is essential to be vaccinated first.
Yes, absolutely. I mean, when you look at this, it's quite obvious that people under the age of 54 or 55, those categories have very few deaths in them, and under 20 has less than 27. And so there are not a lot of there is obviously major reactions. There's people who died in those age categories, and there's also people that are long haulers and still have symptoms and survived, but are still dealing with COVID-19. But as the younger you get, the better off you're going to be. And that, again, is something we've seen with reporting all throughout the world. So this isn't, something where we're any different than anywhere else.
Yeah. Linda's asking about the phone numbers for the vaccine appointment. The best thing to do, Linda, the two numbers, I see that number that you've posted there. The best numbers to look for is the 211 number, which is just the statewide number. And then I've directed a lot of people who are in different counties to call your county health department to find out what information they have. In fact, I called up to Yavapai County for someone yesterday, and it was so easy. Somebody answered the phone on like the fourth ring, and they said, you know what, they have some over at Safeway if this person wants to call back and get a shot. Obviously, it wasn't for me. I was checking for a viewer, but each county has their own number as well. That can be even faster if that helps everybody to get through. All right, Garrett, let's see. Everybody's asking when we're going to get to the 1B category, and especially statewide 1B. We do have some counties that have already moved to 1C, but when, as a collective, would we move to 1B? And Dr. Kara Christ, just within the last hour answering that question for us, she's saying 50 to 60% of group 1A and priority 1B would need to be getting their vaccine before we can move on to the next group. They do still have people showing up for their appointments. They have people no-showing as well, and a lot of you have asked about that. Their no-show rate is between 10 and 20%. So they book for that. They overbook by that amount, and then that's also the hours that you see the +1. So, for instance, I had a family member go to get their shot, registered for an appointment, and they brought with them another family member, and that person was able to get their shot just this week based on people not showing for their appointments. So please cancel if you can. If you're not going to be there, open that appointment up to someone who is ready for it. But +1 and then adding more appointments is what the state does to those pod sites to make up for that 10 to 20% that they know might not show. The other thing is we have another statewide pod opening on Monday. So let me give you this advice. Set up a profile now if you're trying to go get that vaccination at that site on Monday morning. Go into the system, go into AZDHS, set up your profile, get your password, get registered, do all of that now on the weekend ahead of time. So on Monday morning at 9 a.m., if you would like to go sign up for one of those shots at the East Valley site, the Chandler site, that I believe it was a Dignity Health site that's now being taken over by the state pod. If you're going to sign up at 9 a.m., get all that out of the way beforehand. What was happening to some folks is they'd find an appointment online, they'd hold it, and then go in and try to set up their registration. When they'd go back to their appointment, they would have timed out and it would have already been gone. Eliminate that for yourself by just signing up for this early, getting in there, and then going back on Monday morning at 9 a.m. and signing up. So those appointments at the Chandler site start Wednesday at 9. That's when the appointments themselves start. Booking for them starts Monday morning at 9. So 2 different time frames to think about. And Garrett, one of the things I didn't think about in all this, there is not only a rush to get everybody vaccinated because we'll get closer to getting this thing over with, but also how are we going to run these pods in the heat? You're not going to be able
Yeah.
to have these nurses and all of these volunteers and all these people out there running these pod sites 24/7 when it starts to get a lot hotter here in Arizona. So right now they're looking at some places that they can have some cooler sites where they can keep their volunteers and their staff cooler. But so the rush is really on in both of those categories, not only to get everybody vaccinated, but also to move those pods out of the heat and have sort of a walk-through clinic or a place that cars could cool so they're not getting overheated out there.
Now, another thing that's interesting on vaccines, when we look at, say, a bar chart and look at the average distribution, I have it pulled up right now to show. I just put this together yesterday. This is what our vaccines look like right now. If you chart them, and this yellow line is a 7-day moving average, you can see that like 3 weeks ago, we really ramped up and really hit a peak. And then we sort of fell back to where we were in early February. And that's sort of where we have been. And what's interesting about the 50 to 60% is, this is of course an estimate, a population estimate is that 50 to 60%, because all we know is we can look at the census data and look at what the population denominator is for the 65 plus, but we can't do that for the other, the healthcare workers or any of the other people in priority 1B. So we're sort of having to take them on their word as to when we get to that 50 to 60% to move to 1B. But what's interesting is that we're not seeing a ramp up of vaccination administration anymore. It's pretty even at this point.
Yeah, and they were saying those exact same things, looking at the census numbers for these next groups to see how many people would be in these groups that they're opening it up to. This priority 1B, moving from priority 1B to full 1B, that's a lot of essential workers. That's a lot of people vying for a position.
Oh yeah, and it's funny you bring that up because we had that talk about. Hold on, let me stop screen that. We looked at that new addition to the AZDHS website yesterday, and we'll bring that up to everybody right now because now that you're talking about those 1B workers, that's a great time to bring this up. So this was added to the website yesterday at around 5 p.m. This is azdhs.gov. It's a COVID-19 vaccination eligibility checker. And both of these do exactly the same thing, both of these forms. But if you select an age group, come down here and say you select 65 plus, it's going to say you're eligible. My understanding is that's not entirely accurate for all the counties.
Yeah, because Santa Cruz is not taking over 65 just yet. They're the only one. Obviously, a much smaller county, but to say eligible, it's not necessarily unless you were wanting to drive from Santa Cruz up to like the U of A site.
State pod, yeah.
Yeah.
And then if you go to some of the other groups that are not over 65, it's going to ask for your profession. So if we look at this list, this is a pretty. Oh, did it not show up?
It didn't, but if you do the pull down bar, we can only see select a profession.
Yeah,
we can't see your pull down bar.
It up a second time. That's kind of interesting.
Oh, that is interesting. And here's why that's interesting. The list was not in any way complete, and it was a bit misleading for folks who would log on there, look for their profession, and go, "What? I'm not in 1B. I thought I was in 1B."
I have little tricks that I can do.
You
really
saved
quick it, so I can print screen it and then show you my print screen, so I can show everybody what this is because that's very interesting. But let me crop this out. And then I'm going to share this screen. This is this is just literally like Microsoft Paint. I just, clipped it out and I'm showing you the list of professions they have on here. So what's interesting about these lists of professions is, like you said, most of these are very narrow in category. Healthcare worker, long-term care facility staff, emergency medical service worker, protective service occupations, education and childcare. We know that all of those are 1A or priority 1B, every single one of those. And then here now we're going into a list that looks like it's a 1B list because this is an essential services, power utility worker, food service distributor, grocery worker, restaurant worker, public transportation provider, airline staff, gas station staff, auto shop worker, other transportation, Uber, Lyft, state, local government worker, business financial services, which is by far the broadest category on here,
right?
Bank teller, and then bank employee. Very interesting list, as I don't believe this is a complete list.
It is not. There was a discussion of that today about several industries that were left off that list, and they admitted in the briefing that it was not a complete list. Some that come to mind are construction workers, real estate professionals, folks in the media as well. There's several categories that were not listed on there, and they said that this is not a complete list. But it's interesting that it was launched and it wasn't ready. So if you've gone to that tracker in the last 24 hours, I went through the whole list. If you've gone through that tracker, just know that it is not yet complete. And Garrett, by the looks of it, if you can't pull it up anymore, maybe they're doing some work behind the scenes on it right now to kind of make it more.
Oh no, I was able to pull it up.
Oh, you were? We just couldn't see it.
If for some reason it didn't show up on StreamYard, the
okay, the service that we're using. Okay, so just the caveat there, just be careful, folks, if you're going to go use that sort of tracker, because it is not up to date just yet.
It doesn't look like it's fully completed yet. Absolutely.
Yeah. Okay. All right. If we have time, I'd love to update everybody on a bit of the zip code and schools dashboard. If you need to take a breath or a drink of water there, Garrett, because I know it's a lot of talking, and just update everybody. This came out on Thursday morning. We weren't here with you yesterday, so I want to make sure we show you where you can find all of this. I want to tell all of you this is only Maricopa County, so this does not expand outside that area. We're lucky enough to get this from Maricopa County. We're not intentionally leaving anybody outside of that area. It's just that we have these breakdowns, and they're very telling. It's been interesting because of the neighborhoods I pulled up yesterday, I was seeing numbers fall by like 50%. So if they were like 326 per 100,000, it was down in like the 175, 150 range. I mean, really seeing those numbers fall fast. Also, that CLI number on there is really helpful. So we'll show you what this kind of looks like. We can go through some of your zip codes, but if you'd like to look, remember to look by your zip code, look by your city, and then look by your neighborhood school district, because that is going to give you the best well-rounded picture of how your neighborhood is looking right now. And this also becomes more important as we expand this out throughout the state. As Garrett's pulling this up, we can talk about some of the metrics statewide after that and why that's important, because the state is looking ahead these next few weeks to start considering easing restrictions on other parts of the state. I refer to outside of Maricopa County next, but for this purpose, and for so many folks who have their kids heading back possibly to school on the 15th or 16th of March, they're watching these numbers closely, Garrett.
Yes, and just these numbers, and I'm pulling this up right now. I just had to I had to run my first. I like to show my personal maps first, because they tell a little bit more of a story than the GIS map. The Maricopa map, but not very good at doing two things today.
No, go ahead. I'll update some other things as you're pulling that up. One of the big concerns that everybody's talking about right now as we track all of this is also how spring break is going to factor into this. It was one of the concerns Dr. Kara Christ brought up in her discussion today about how the state is handling things. And as we get closer to the possibility of things opening up, is what will spring break do to this whole situation? If people are traveling and heading out there, they were saying we did not see a bump like we could have seen after Super Bowl. But of course, you saw just a few minutes ago in some of those numbers and the different story that we saw on things after Christmas and after Thanksgiving and after New Year's. And they're just really concerned that the same thing could happen, coupled with the increasing number of variants out there. So those two things are of concern. They're urging people to be very careful if they are going to be traveling in March for spring break. So just some things to consider.
I think it is very important to mention that with the data, how it bears out is as we progress along this timeline and more people get vaccinated, it then becomes more of a fight between the variants and the vaccines, because sort of as more people get vaccinated, more quote unquote normal activities that we do are going to become less and less overall risky for some sort of breakout hotspot, if you will. I'm not talking in the single person. I'm talking about large groups of people. Right. So it just becomes less risky over time. But that is just that assumption is based off of having no variant that is vaccine proof. So if a variant does emerge that is vaccine proof, and look, I'm not trying to down everybody's
party
a downer, but it is something that is a concern. However, so the information we've seen so far, we've talked to ASU multiple times about the variants, and the good news about all of this is nearly all the variants that are of a concern, because there's thousands of COVID-19 variants, but the variants that are particularly of concern, most of them are covered by at least some part of the vaccine. And I think all of them, so far, studies are showing that they prevent major COVID-19 illnesses. So while you may, if you're vaccinated, you may get COVID-19 from one of these variants. So far, they have zero evidence of anyone getting a major hospitalized version of COVID-19 from one of them.
Yeah, hospitalizations or deaths at that point. And that's not unlike what a flu shot does. I mean, I hear from people all the time, oh, I got a flu shot, and then later that year I ended up getting the flu. It's to protect you from the severity of it, not to say you have a scot-free card that you can just go, cough on everybody. So it's
like the flu, and Randy's saying that exactly. Like
saying. So that's the concern in all of that is to make sure everybody understands that. So lessen the severity, take the stress off our hospitals, save lives, and get us all back to normal. Okay.
So I'll just show this map first, and then I'm going to go to the regular GIS map because I like to give this one context. It gives us some regional context about what's going on. So you can see that cases in the middle of Maricopa County, very low, under 100 in almost all of these cases down here. The 101 corridor, northern East Valley, almost all down under 100. The West Valley, again, a little bit worse. You've got some 178s, some 223s. Your highest out here is going to be the 85256, which is the talking stick, the Salt River Pima reservation, and that's at 386, which, I mean, at one point we're at 1,200. So that's still, a fantastic number for them. But here's sort of just what things look like. It looks like, again, things are slowing down slower in the Southeast Valley. In the rest of the valley, it's getting a lot better. So now that we've shared that, I am now going to go and take you to the Maricopa County site, because then we can look at things zip code by zip code. But as we've talked about before, and it is not an experimental vaccine, Karen Showalter, they've done a lot of work on it. And I saw somebody said something before, someone had said something about people who die from the vaccines. There's no evidence of anyone dying from the vaccine.
I know there's so much misinformation out there on the internet, which is sad. But you know what? At this point, there's so many people that really, really want the vaccine. So that's okay. Step out of line and let somebody go ahead of you who is very excited to be a part of getting to change and getting back to normal and getting our lives back. So if it's not for you, it's not for you. And let somebody else who is desperately waiting to get it, who has been online and making calls to try to get in and get it.
So this is what we look like.
Or yellow. There's more yellow, Garrett.
Yes, there's some yellow. We've got a tiny bit more yellow in the rurals. So you can see we've got some. Now this time period is January 31st to February 7th to February 13th. So that's why we're starting to see yellow. So because we're now starting to see situations in which 2 weeks of data is now under 100 in some of the rural areas. We should be seeing yellow in a lot more places going forward here. So if we go to the RT, I'll just talk about the RT. The RT is at 0.8 right now, around 0.8. Andrea, and it's still one of the lowest in the country. It's no longer the lowest, but it's still low at about 0.8.
Great news.
So if we look at some of these zip codes, we can see we have mostly 185. Here's a 95 right here. You can see Paradise Valley. This one, percent positivity rate is under 10. Their case per 100 is under 10. This zip code is going to move to yellow next week.
Yeah, they either went back to school this week or are going back right after spring break. So those numbers bear out for them.
Next one, 85028. This will move to yellow next week. This zip code 85016. Looks like it might not move to yellow because right now it's at 101. It's at the cusp. These are recalculated every single week. So it could move to yellow, but it also might not. So there's going to be some of those. 85258 for Michael Ramsey. This one, 140 with a 10%, just on the cusp of moving to yellow. It might happen this next week, but realistically, probably 2 weeks from now. In fact, I'd say most definitely 2 weeks from now. Because we already know what this data looks like for at least 2 weeks, and it's going down. So this definitely will go down any farther. 85029 for Katie. 85029, 115 with a 9%. This could be in yellow next week.
Yeah, very close.
Very close, but realistically, probably 2 weeks from now, will definitely be yellow 2 weeks from now. 85048. 85048. This one is already has showing yellow and a green percentage, 5%
Wow,
positivity.
that's
This
great.
85048 will be, this is Awatuki, I believe, and it will be yellow next week. 85022. 85022 is, just on the cusp. It might take 2 weeks, Brenda, for 85022 to show up as yellow, but we do know things are, going down, especially in these areas. So 85051. 85051, we have 179 to 15%. This, I don't know if this is going to make 2 weeks. It might be 3 weeks for you, Vicky, to show this zip code in yellow. Where is this? This is right smack dab in the middle of Phoenix on the western side. So this is one of the zip codes that was hardest hit at some point. So, it's going to take a while for it to get there, but it will get there.
Yeah. Hey,
85295. Gilbert, this one looks like it's going to be at least 2 weeks. It's at 147 right now. That's probably not going to calculate down past 100. So it's probably going to be 2 weeks for 85295. 85212. 85212, 150 and a 7%. You're probably looking at 2 weeks there, Joe, to have this zip code be showing up as yellow. I do not have an 857, Rita. I'm so sorry. 85040. I only have Maricopa County. 85040, 247. This is actually this was hit very hard at one point. You can see this is near downtown Phoenix, I believe. This area, 247 to 17%, 383. It's not gone in half, but it could be several weeks until this is a yellow zip code. But if we look at the zip code map that I put out, it should happen, in 3 weeks, but it looks like it's going to be a little longer than the others. So, like I said, everything's still going down, so that's good. 85338. Here it comes. 85338, 201 with a 12%. You're probably going to have to wait at least 2 weeks, Donna, but things are looking good in that zip code. 85323, right next to it in Avondale. Same situation there. 248 with a 15%. You're probably looking at least 2 weeks, maybe 3. 85345. 85345. 206 with 11%. 2 weeks, maybe 3 weeks to have this one show up. And this, of course, when I say that, of course, everyone must know, or, you need to know that is based on our current trajectory. Okay.
mhm.
So obviously if things start to change, then nothing I'm saying means anything. I know things have slowed down for about 5-7 days now, but there's still some movement here for it to go down. 133 to 766 for 85050. This could be about 2 weeks, but it's on its way and should be there soon. 85296. 150, similar situation to the one we just looked at. 150 to a 9 with a 10% positivity rate. You're looking at least 2 weeks, Jeff, for this to show up as yellow, most likely. 85225. We're very close to it. In Chandler, again, 141. This looks like this is another 2 week caller here. You're at a 141. It's got to get down under 100. So likely 2 weeks for it to go yellow. 85033. 85033, 193 with a 16% positivity. This looks like it's going to be more than 2 weeks. So this could be a 3 to 4 week zip code before it shows back up as yellow. There was a time, didn't we, at one time? I can't even remember anymore, Katie. Wasn't there a time when we all, nearly everything was yellow?
Yeah, I mean, I'm grateful right now that we're able to do this map once again, because it made no dang sense for a while because we weren't doing well enough. So it's so great to see this back. It's just such a hopeful sign, and I can't wait for the next few weeks as it falls even more.
85140 is at 123. This could recalculate down to yellow for this next week. Realistically, probably 2 weeks for this one, but it's close. It's on the edge. I already did 853. That's funny. All right, 85086. 153 to 11. Same situation as that last zip code. This looks like it's going to be at least 2 weeks, maybe probably 3 weeks for this one. Realistically, 85202. 85202. Oh, 357. 85202. So 85202 is a just to show you what's going on here. There is a Banner Desert Medical Centers right there. And so Tiffany, this particular zip code is probably going to hold onto the red for a lot longer than the others. This is I believe right now, let me look. 85202 is the top zip code in the state right now with the
So Garrett,
number of COVID-19 cases.
So Garrett, what you're saying, and I want to make sure that I'm understanding this right to Tiffany, is that because there's a hospital in that area, some of the tests would be tested
Yes.
as the hospital zip code.
Yes, that doesn't
And
necessarily mean that it's a bad zip code. It's very likely closer to, say, 852, because you're not going to have a situation in which the community outbreak in 85202, zip
yeah,
code boundaries don't even really exist, first of all.
right.
These
It's a made up thing, but it
It's a
shows our
made-up thing.
neighborhood. So
So-
would you look at her neighbors? Is that
Yeah,
what you would
so
do?
if
Is
we
look at
the next one over,
okay.
and we see 140 with an 11%. That's more likely what 85202 looks like in the community. So
This is a really good tip for Tiffany too, because so if she looks at those zip codes around, but even more so, do you think that if and she can go play with this map a little bit more, if she found a school district that didn't have the hospital in it, that she would even get a drilled down closer number to what it's like right there in her neighborhood, that might help her?
This is, I believe, this is a unified school district, so
So it might be too big.
It's too big to
Okay.
be use to look at the community spread for this area. But like I said, for some reason 85202 has been flagged. Sorry about that. As a Banner Desert either is one of the premier COVID-19 facilities out here as far as taking patient doing tests or doing inpatient, because a lot of tests are coming from 85202, a positive test.
Okay. All right.
I just because Banner Desert is so large, and we already know that hospitals play a large part in some of this data. So the general assumption is that 85202 is as high as it is because of the hospital.
Okay, so thank you, Tiffany, for joining us on here, and I hope that then helps you. Look at those surrounding zip codes for more indicators.
85326 is at 223 with a 15% positivity rate. We can do one more. I just realized we're at 41.
That's okay. We can do Christians, and then we'll move on to just a few more things in our time here.
South Mountain 85042. This is at 170 with a 13%. This looks like it is going to be at least 3 weeks, I would say, for this zip code to be back in the yellow. But
okay.
Very encouraging news for almost every zip code. There's I didn't actually run the numbers today, but I would be very doubtful to find almost any zip codes that are increasing in numbers. And if they are, they're going to be rural or fluctuating zip codes with very few people in it, where, one person that, 10 people that positive could
sway that number. Right.
And so things are looking very encouraging all over the valley.
Very good. Let's answer MK's question about Pima County. Do you know if they have something like this in?
Let me show it to you. We don't use it as much, obviously, because we're a Phoenix station, but they do have something. I will bring it up here as soon as I can find it. Excuse me. Where is their dashboard?
And as you're bringing it up, I just want to remind folks the reason for anybody that missed the beginning of that there, we're so lucky to get that from Maricopa County. We have a weird and interesting and yet helpful situation here in Arizona, that we have this one county that is so populous, more than half of the population of our state concentrated here. And because it's so large, because we have all of that, we have more resources, more data for us to pull and show you. So because of that, we're grateful to have that, but let us help you find some of the other stuff too across
so let me just show this
Arizona.
Really quick. This is the Pima County dashboard. It's a little bit different than, and by the way, Pima has, like, bless their heart, they have the worst internet domain names in the state. So we're going to show,
because they're long and convoluted.
Realistically, for most of you, just Google Pima County COVID-19 dashboard and you'll find it. So just so that you know. So this is Pima County's numbers. Let me see. We're on zip code right now. There's actually some really cool things about even Pima County that, can you take the lower third out, please, producer Carrie, so I can show these bottom graphs? Okay, thank you. So this is something that not even Maricopa does, that I think Pima does just fantastically. You can actually drill down on zip codes and actually see their cases by date. Right here, as soon as I can get it to pop in. And so you can see cases by date here. This is an epi curve, and you can do this by zip codes out in Pima County. So It's a very, very cool tool that is useful because you can just really see what's going on in each zip code.
Yeah. Good stuff. Hopefully that helps. We can copy that weird URL over, easy for me to say, MK, and put it in the chats there for you so that you could just bookmark it on your page. You should see my screen that I use right here. I mean, I've got everything bookmarked from AZDHS to, I mean, every site we've ever used.
That one, it is just a tough URL.
Yeah. That's too hard to keep up with. Okay, so it's Friday, or coming up on the weekend. We are out of time for today. Michael's asking about any variants in Arizona. The best place to check is the CDC. They were talking about some of the screening that's done, that some of these tests are sent to both ASU and the CDC to continue to track for variants, and that they're doing, Dr. Karakuris just said, like the contact tracing over the top if they find a variant. So that's one of the big things.
They're trying to ramp up the number of of samples they are sequencing
to screen for that sequencing.
At this point, if you're not sequencing every single,
you don't know.
Out, you're not going to get the variant. You're going to get it 2 weeks late, and at that point, it won't matter.
It's too far gone.
Hopefully, they're ramping it up as quick as possible.
Okay, we've been on a little bit longer than normal. I wanted to get to some of the questions since we weren't here with you yesterday. We will be back next week. There's going to be even more to track this J&J information today, and this approval is so hopeful. Again, if you missed us right off the top, they plan to, if this follows suit from the last things. Oh, thank you for all the nice comments. You're so welcome. If this follows how we've kind of done it with the last approvals that have gone through on a Friday, conveniently, it means that they'll ship on Monday. It'll arrive in our state here in Arizona on a Tuesday, and then the vaccination will be arriving in people's arms by like Thursday or Friday of next week. I saw a couple of comments, Garrett, that I just want to address, that they were saying like they weren't really comfortable with the J&J vaccine for some of the things that have gone on recently. That's okay too. Just be sure to choose the site based on what they have. So remember, the state pods have Pfizer, the county pods have Moderna, and then we'll hear a little bit more about when J&J gets here for where those go. So just keep in mind it's based on location. So you can't just show up and say, like, I want a peach smoothie. You only have strawberry. You got to go to that specific site. So you'll have to plug into the site that you want based on the shot that you're looking for. If you do indeed have a preference, I know so many people are like, just give me anything. I just want to get this thing over with. I've had enough of the pandemic, right? So, we've heard both sides, so we just want to make sure that you get all those answers as well. Okay, where to find us? All of our coronavirus reporting right there at abc15.com/coronavirus. You can find Garrett on Twitter at Garrett_Archer. I'm over there as well at Katie Rammel. Many of you are watching us on Facebook Live right now, and you can find me on Facebook at facebook.com/news from Katie. People are announcing over there that they're not getting the shot as well. I think people just feel like saying it. By the way, if you are announcing that you have gotten the shot, be very careful. Post the sticker, not your card. Your card can be a source of identity theft and a security issue. So get a sticker from them or post it in some other way, your smiling face after you get your vaccine instead of your card, so that we can keep you safe from your identity being stolen. So with that, have a great weekend. Be safe, mask up, and we'll see you back here next week.